Tonight, a tree surgeon impales himself on metal railings.
So 3 holes, 2 flanks, okay, 1 midline.
A motorcyclist is thrown from his bike on a busy motorway.
How have you got here?
I crawled over.
You've crawled over to been hit with?
I'm not sure.
And a 6-year-old girl is seriously injured in a road traffic collision.
Let's get this old one off.
It's early morning, and critical care paramedic Tom Waters and paramedic Ben Reen are preparing for the start of a 12-hour shift.
You can't expect any type of job. You just turn up and go with the flow. That's why we do our checks and things like that, so we just prepare for the day, and the better we prepare, the better we can manage the unexpected, really. So, yeah, don't know what's going to happen today, not at all.
Ambulance service, is a patient breathing?
Yes, he is. What's happened is this tree surgeon is fallen from the tree and impaled himself on a steel spike that was below it.
Okay, is he conscious and awake?
Yes, he's conscious and awake, but the spike has gone through towards his kidney area. They've got him off it. They're trying to put some towels on to stem the bleeding.
Did he look extremely pale?
He does look extremely pale, yes.
Yeah, okay.
He's now going paler every minute.
Of course, so we do have an emergency ambulance arranged for him, okay?
As this is a potentially life-threatening accident, Tom and Ben are immediately dispatched.
So we are going to a report of a 60-year-old male who has fallen out of a tree and impaled himself on some sort of spike or some metal. We are looking at some quite significant potential injuries from both the fall and the impaling of the spike.
Patient seems very pale and more paler by the minute. They're using towels to stem the bleeding. Patient now off the bar that impaled him.
No worries, thanks, Colin. So we've also got 03, which is one of the helicopters coming as well, just in case he's really, really quite poorly. Tree surgeon. I'm going for the tree surgeon.
You reckon?
I think that's a sensible option, isn't it?
Tom and Ben's colleagues, the Air Ambulance Critical Care team, are already on scene.
Hello.
Dr. Ali Hussain gives Tom a quick update on the patient's condition.
Hey guys.
You're right.
Hey. So 3 holes, 2 flanks, okay, 1 midline.
What's your name, sir?
Alan.
Alan.
64-year-old tree surgeon Alan was cutting back branches in a client's back garden when he lost his footing.
It feels difficult to take a breath in. It's okay.
Alan fell 12 feet onto metal railings, which embedded themselves in his lower back. The homeowner called 999.
Take a big breath in for us. Do you find it's catching you?
Dr. Ali is worried that one of the spikes may have punctured a lung.
In terms of chest, air entry's good. Belly is tender.
Yeah, fine. It's a bit difficult to know how far they've gone in. It looks like it could have gone in a bit further. But at the minute, the breathing's okay and everything. So, but we don't know how far it's gone into your chest, okay? So we're going to get a drip in, okay? Just reduces the chance of any bleeding, okay? How is your pain at the minute? Roughly out of 10, would you say?
Yeah, I think probably if we could.
If 10's the worst possible pain you could have, and 1's very, very little. Out of 6. Okay.
We'll get some TXA in.
Yeah.
The team are concerned about the level of damage the 4-inch spikes may have caused Alan's internal organs.
Yeah,
What actually happened?
I was in the middle and it just stepped over it and just landed on the spikes.
At RAF Cosford, the headquarters of Midlands Air Ambulance, Dr. Andy Owen and critical care paramedic Alistair McNeil are preparing for the start of their shift.
Go on, what are we expecting, Alistair?
Rain and going dark early. It's that time of year again, isn't it? So, PPE, I saw you
I've
with
put
my
yours
PPE.
in, yeah, drugs are in there, blood's in the back.
The helicopter is designed to carry the most advanced life-saving equipment, and everything has its place.
When we arrive on scene, for the nature of the work that we're doing, a lot of our cases are sort of time critical, so being able to just open a cupboard and grab the right bit of kit is critically important for us, and the patient, obviously. Are you happy? Yes.
Cool.
An ambulance crew is called into control to report a serious road traffic collision in Shropshire involving multiple vehicles.
Hello, 03 Alpha, lifting Spartan Space.
So you're going to a two-car RTC head-on. 5 patients, 3 paediatric patients, 1 with a significant head injury. All received.
As there are reports of children with potentially critical injuries, Dr. Andy and Alistair are scrambled.
We'll give you a shout when we're overhead, over.
It takes the helicopter just 12 minutes to reach the scene of the accident.
Oh yeah, DCA in the 2 o'clock, yeah, multiple resources, yeah. Anyway, 30 to Whiskey Alpha, we're overhead scene and looking for a landing site, over.
There is a huge field. Oh, right by him.
Dr. Andy and Alistair land in a field next to the road, which has been closed off by police.
This is not suitable for a local hospital. Right. Looking at that smashed up front.
As they get closer, it's clear this is a significant incident.
So it's a 50 limit.
Downhill though, isn't it?
It's a 50 limit downhill, sweeping bend, somebody lost it on the bend and gone straight over.
Head on. 100 miles an hour, potentially transferred energy, isn't it? So.
Yep.
Right.
The fire service and 3 ambulances are already dealing with the scene.
We've got somebody sitting in a
got
chair.
Some walking into there. Oh, you're right.
Hi, John.
Dr. Andy and Alistair are briefed on the casualties by the operations manager.
Fine. Yeah.
Head laceration.
Yep.
Okay.
A little bit being unresponsive at times, very distressed.
All right. Yeah. Okay, fair enough. And how many people we got in total, mate?
So 5 in all.
Yeah.
Yeah.
Essentially 4 walking wounded as well.
Fine.
Dr. Andy's priority is to examine the most seriously injured person, a 6-year-old child.
Hello. Oh, you're holding a patient. Hello. All right. Okay.
A 6-year-old female. She was in the 3rd row of the black car.
Okay.
Booster seat belts on. By the look of it, heads hit the plastic tray in the chair in front. Unknown of loss of consciousness, but instant blood coming from the wound.
Yeah.
Roughly
Okay.
30 mil.
Lola was travelling home with her brother and sister from a martial arts lesson. She was strapped in the back of her mum's car when it collided with another vehicle.
I'm sorry.
Yeah.
Fortunately, the other 2 children escaped with minor injuries.
So I guess the question here is, where's Mom or Dad?
Outside on the left there.
Okay.
So I've just come out of sight for a minute because she was getting quite upset.
Although Mum has also been injured, she is staying close to her daughter.
We are alert, however we are having increasing periods of
drowsiness. Okay.
Really unable to do a blood pressure. The only thing I've been able to give you so far is a red breath of about 28 initially.
So do we know if there's been a loss of consciousness or not? We're not sure. Okay.
Lola has a serious head wound. Her intermittent drowsiness is a cause for concern. She may be in shock. She could also have other internal injuries that aren't immediately obvious.
Yeah. So I think the plan we're going to do in a minute, folks, we'll get back to the helicopter ready. It would be lovely to immobilise her, but I think actually if we just pick her up as we are and we walk up the road to the field, wrapped up in a blanket, onto a scoop when we get to her.
Before they move her, Alistair checks Lola's head injury, which is still bleeding. A large piece of skin has been torn away, exposing underlying tissue.
Let's get this old one off.
All right, my sweet.
03.
03, go ahead.
Dr. Andy updates the trauma desk.
Yeah, just an update from scene. There's 5 patients. The one that we're concerned with is a 6-year-old with injury to her head. We think the best thing to do with her is to put her in the aircraft and try and get her to the children's. Are you guys able to start sorting that out if we start packaging her to go? Is that okay, over?
Yes, mate, cheers, Andy. Yeah, between us, we will get it sorted.
As the shock wears off, Lola is becoming increasingly agitated. Alistair is concerned she may have other injuries.
Lola? What? Does that hurt on your arm, my darling? It does hurt on your arm. Okay.
Is it time to go home?
Oh, nearly.
I
We're going to see the doctors. Let's take...
All right. I think that's the arm.
I'll give you a phone call once I've had a chat to Mum, and we'll sort it all out. Over.
Tuesday, yeah.
Dr. Andy wants to fly Lola to hospital in the air ambulance, but first he needs to clear it with Mum Jenny, who is driving the car.
Hi, sorry to keep you. My name's Andy, I'm one of the doctors with the air ambulance. So we just had a look at a little one there. She's okay. I'm not overly concerned, but she's got quite a nasty cut to her head, and she's a little bit sleepy. I think because of that, it wouldn't be appropriate to take her to the local hospital here. I think she needs to go to somewhere that's a bit more specialist, like the Children's Hospital. Now, that's quite a long way, so what we're probably going to have to do is pop her in the helicopter and fly her. The advantage of that is that it's the best place to sort her out. The downside is we can't take you with us, unfortunately, because we can't get you in the helicopter and it's not an adult hospital. So that means we're going to have to take her, if you're happy with that. Is that okay? I know, I appreciate that, but I think it's probably the best thing for her. If she gets re-agitated, we can always give her a bit of medication to calm her down and relax her. And again, that's not an uncommon thing that we might need to do. But like I say, she's got a nasty cut, and I think the best place for that to be sorted is at the Children's Hospital, rather than at somewhere that doesn't deal with it quite as often. Is that all right? OK. Forgive me, because I've got quite a bit of organising to do to sort that, so I'll come and have a chat with you before we go anywhere. All right? OK.
Jenny has an injury to her arm and will be taken by ambulance to the local hospital in Shrewsbury.
Is there anyone else that needs us to have a look at them here?
No, I don't think so. Spoke to driver at the 4x4. He declined any form of assessment. Driver of the vehicle was on the back of with the BCA. Crew are happy with her. Yeah. So we've got the two children in this car.
Yeah.
So you can just have a quick glance at them. I haven't been told of any concerns with them, but...
Fine, OK. That's I'll have a quick look.
It's 6:30 p.m. and starting to get dark. This restricts which hospitals the helicopter can land at.
So if we can do Alderhay in less than half an hour...
OK, yeah.
They're just giving us a distance to Alderhay.
Fair enough, OK.
Just because if we can go straight there.
Dr. Andy is weighing up flying to Liverpool, home to one of Europe's biggest children's hospitals, Alderhay. It has the advantage of a lit helipad.
Straight in and straight out, so that might work.
While Dr. Andy works out the logistics, Alistair has been able to take a closer look at Lola.
Shoulder may be dislocated, the seatbelt bruising now coming out on that shoulder, and she's screaming when I touch it. So we've got the head laceration and plus shoulder injury.
Do we need to do anything about it?
No, I think we'll be able to pick her up and carry her quietly, but it's whether she's then going to cry en route, and we need some pain relief. So
should we get some access?
Probably, if you want to do access. Yeah, sorry, if you want to try access.
Which shoulder?
Left shoulder is screaming, and there's bruising just coming up on it.
The quickest and least distressing way to get Lola onto the helicopter is to carry her. But first, Dr. Andy must insert a cannula into Lola's arm to give her pain relief.
Hello, I'm sorry. I'm sorry. Listen, we want to give you something to make you a bit less sore.
Have a bag then. Cheers, sorry. Save me. Are in everything. Thank you.
With the light fading, they need to get airborne fast. Alistair checks the flight time to Liverpool with the pilot.
I would say worst 30 minutes.
OK, and we're there.
You're at that straight at the ED, aren't you?
Yeah, that's probably worth it. Have we got the fuel?
Yeah, we've got 500 kilos of fuel.
Yeah, OK. Probably going to be our option. It's lit as well, isn't it?
It is.
OK, fair enough.
Rob, can I give you this and then I'll update the desk?
In Wolverhampton, the critical care team are treating 64-year-old tree surgeon Alan. He was cutting back the branches of a tree when he fell 12 feet, impaling his lower back on metal spikes.
7095.
Ben fits a cannula so drugs can be given intravenously, while Tom updates the trauma desk.
So this male is probably in his late 50s, 60s. He's fallen and impaled himself on a metal spiked fence. From visual inspection, he's got 3 punch wounds, central back, lumbar region. So currently just getting some IV access, giving him some TXA and doing some clinical observations. Currently, the aircraft has landed probably about 200 metres away.
Alan is given a drug called tranexamic acid, or TXA. If he has internal bleeding, this will help the blood to clot.
You know when you're sort of like squeezing your bottle together? Can you do that for us?
Squeeze together,
yeah,
right?
Good lad, that's fine. And you feel everything down below where you sat on?
Dr. Ali checks if the spikes have damaged any nerves in the spinal cord, which could lead to paralysis.
You're sitting on a bicycle seat. You can feel everything there, in that area.
I can move everything,
yeah. And it's really kind of...
Yeah. Now, you sure we can't give you some pain relief? No? Right, okay. They're pretty nasty things to fall on, aren't they?
They are.
We give this antibiotic, sometimes a bit stingy. Okay.
Yeah, is that the Coamoxiclav?
Yeah.
Coamoxiclav is a penicillin antibiotic. This will fight any bacteria that was on the metal spikes and help stop infection.
The ambulance has just pulled up. We're going to bring their stretcher to the patio. Gentle walk, take a seat, and then we'll pop you over to the QE. Is that all right?
It's because of the nature of, well, first of all, if you look, then the spikes have gone in quite a few inches. So we'll take you to a trauma centre, okay?
Tom, Ben and the air ambulance medics are happy that Alan travels to hospital by road.
Copy of the odds for you as well.
Swing your legs.
Tom will travel with Alan to the Queen Elizabeth Hospital to provide advanced critical care if required.
So, we've got, in regards to pain relief, I was going to give you a bit of morphine en route, if you're happy, or would you like some pain relief? You sure? OK. If that changes en route, then just let us know, and we'll go from there. This is a dangerous job you guys do, isn't it? It's naturally going to...
Very often anything.
No!
Very rare, but that was just... I just tumbled out of the tree.
Yeah. And if that fence was there, you'd have been fine.
Yeah, if I'd landed a few yards.
Absolutely. Yeah. You'd have just got up and carried on cutting. How did you get yourself off?
I had a tiptoe on my feet.
Really?
To lift myself off this place. Because I couldn't pull because they were...
No, because they were inside here.
Alan may be putting on a brave face, but his injuries are profound. Tom will be keeping a close eye on his condition in case he deteriorates.
I'm just going to take your blood pressure again, if that's all right. That's going to go a bit tight on your right arm, that blood pressure, just taking your blood pressure, OK. Right then.
Only a scan in hospital will confirm whether Alan has damaged his spine or any internal organs.
2 on the side don't look too bad. I think the main one's been in the middle of your back.
What?
Yeah. But the fact that you've walked and you've moved and you've got no pins and needles in your arms, on your legs or anything like that. No, does it feel okay? Good. So that's the only thing they need to be quite, we need to be quite careful about. But you're normally fit and well. You don't suffer with any medical problems or... Oh, you look it, to be fair.
Arriving at the Queen Elizabeth Hospital, Alan is handed over to the waiting emergency team. In Albury at base, it's the end of a long week.
What's to do?
Just the eye gels.
Critical care paramedics Ryan James and Kerry Hemus have been on the same team many times before, and between them, they have over 25 years' experience.
Just to let you know, we're here and we're just checking, we're nearly done, so we're available.
Who's we?
It's me and Ryan James.
Hello, Ryan James. You all right, Ethel?
Ethel.
I am very well, thank you, my love.
Have a good day.
Right, I need a tag.
Kerry, it's your lucky day. Not only did you get to work with me today, we found a spare tagline around. How about that? I don't know which one's better.
Honestly, I'm not sure either. I'm quite overwhelmed by it all.
Here we go. Here we go. And so it begins.
Ambulance services, patient breathing.
No, it's not. Please, my baby keeps stopping breathing.
All right, sweetie.
Please, come on.
All right.
Go ahead.
16, thanks. Come through as a 17-month-old cardiac arrest.
In Walsall, Kerry and Ryan have been dispatched to a young child who's struggling to breathe.
6-2, roger. RETA showing currently 1:04:14 minutes.
If the child's not breathing, they're in danger of going into cardiac arrest and may need life-saving drugs.
So just confirm, it's 17 month, is that right? Clear.
Every second counts. Ryan quickly checks the correct paediatric doses, which vary depending on the age and size of the child.
Updated assignment.
1.1 mil, 1 milligram in 10 mil. Clear left.
Thank you.
5 mils per kilogram, is it? In
Not in medical.
cardiac arrest.
Moments later, a call comes in.
6-2.
6-2, apologies guys, you can stop now. Conscious of breathing about.
That's great news, thank you. We'll stand down.
Being stood down is part and parcel of the fast-moving world of extreme emergencies.
After all your workings out and everything.
And feel sick. Not a reflection on your driving, Kerry. Just my motion sickness while eyes are in.
With the baby out of danger, an ambulance crew now on scene will take over ongoing care.
Get your belt back and get your cup of tea.
Adults, 3 paediatrics in the red car.
In Shropshire, Dr. Andy and critical care paramedic Alistair are preparing to fly 6-year-old Lola to hospital. She's been seriously injured in a road traffic collision.
I'm just going to take a quick picture of the vehicle.
With the light fading fast, Dr. Andy checks with the pilot to see if Alderhay Children's Hospital in Liverpool is still the preferred option.
What's the plan?
Alderhay.
Alderhay, okay, it's fine.
50 miles. Call it 30 minutes. We've got a bit of a crosswind.
Ah, fine, okay.
Yeah,
It's probably still quick. It's probably still quick, isn't it? Yeah. Are you good if we just bring her up then? Are we good to? Yeah. All right. Fine.
Dr. Andy keeps Lola's mum fully informed of their plans for her daughter.
Right, Mum, you probably heard that. We worked out the times and the distances, and it's easier for us in terms of time to get her to Alderhay. So we're going to go up to Alderhay, which I know sounds like a long way, but flying, it's quicker to go there than it is to go to the Liverpool. Yeah. We're going to carry her over to the helicopter now. All right.
The ambulance crew reverse up the road with Lola to the waiting helicopter.
We've got blankets around her, bless her. Yeah, happy with that. OK, so slightly muddy field. Oh, be all right, Lola. So if we come to the back, yeah, we're going to have a lie down.
Hey, Lola, it might be a little bit cold, OK, sweetie?
I don't want it to be cold.
Oh,
I want it to be warm.
We'll warm you up in a minute, Lola. Stretch legs out. Lola, my name's Alistair. Hello. I'm going to look after you. And we're going up to the hospital, see the doctors, OK? So I'm just going to slide you into the helicopter. On. Lola, it's all right, my darling. It's all right, trust me. It's all right.
OK, Lola.
So we're going to just move this a little bit further to there. And then, because you were cold, we're going to wrap some stuff around you. All right, Lola.
How are we doing?
We are packaged.
What's our run time now? We've got 18 minutes to go.
And did family know all of this? Going up Alderhay, so now
So,
we start talking about
both members of family need to go into Alderhay.
Yeah.
Dad's going to drive up there now, once he's dealt with the other children.
Okay.
I've said to Mum that, well, I can't rule out anything going on in her head. She's going to be in hospital for a few days. I need to have a proper look at her. That's what, basically. So I'm not painting a bleak picture, but I've not said she's fine.
There was a policewoman talking to me and said, is it life-threatening? I'm like, well, look, for the size of her and the impact, it could well be.
On the journey, Dr. Andy notices that Lola's become less alert. This is measured on a GCS scale based on her ability to talk, move, and focus her eyes. A normal score would be a GCS of 15.
03, just, I wonder if you could pass an update to Alderhay for us. This girl's GCS has just dropped to 13 during transit. No other changes. I don't think it represents anything to worry about. Possibly developing a little bit of periorbital bruising as well, though it's difficult to tell given the light conditions. But I think it's probably worth just updating to make sure they do have anaesthetic cover down there in case of a rapid deterioration. Over. But our main concerns with Lola are that she's bumped her head and has got a little bit sleepy. That could just be the environment she's in the back of the helicopter, but it could also be something going on inside her head, so we're keeping a close eye on her on the way. Our main concerns would be injury to her brain, but she's also injured her shoulder as well.
And he went to south, so now 20 mile descent, and it off a will call again on lift.
Arriving at the helipad outside Alderhay Children's Hospital,
I'm Alistair and this is Andy, folks. This is little Lola.
Alistair and Dr. Andy hand Lola over to the paediatric trauma team for ongoing specialist care.
Taking off. 03 Echo, just lifted from Alderhay with a direct track back to Cosford.
Hello, ambulance service. Is the patient breathing?
Unknown at the moment. I'm a traffic safety officer off duty. Just passed a multiple vehicle RTC, including the motorbike. Biker is on the floor. It's on the M5 motorway.
You didn't know whether or not the patient was awake, yeah?
Negative. I can't confirm that. So there's vehicles in the carriageway. And I know it's only just happened because there's hardly any queue in traffic.
6 motorcyclists die, and over 100 are seriously injured every week on Britain's roads. For a biker, being involved in a collision on a fast-moving motorway is about as dangerous as it gets. An ambulance is en route, and Kerry and Ryan are immediately dispatched.
It's a traumatic injury, potentially for a high-impact collision of a car versus a motorcycle. Obviously, on a motorcycle, you haven't got any protection at all from, other road users, so you're going to take the brunt of the impact, potentially.
Rush hour traffic is building, making this stretch of the motorway difficult to navigate.
6-2, just before we get to another junction, have we got an idea, an approximate location before you send it?
So it is on the southbound carriageway just before junction 4, is it?
7062 on channel, ETA approximately 1 minute.
And with the biker's life in danger, every second counts.
Just stay there.
Back at base in Albury, another team of critical care paramedics are starting their shift.
Ball bearing's got to go on that side, hasn't it? So that's it. Flick it that way.
The first job of the day for Faye Pollock and Alistair McNeil is making sure their vehicle is spick and span.
See. Not just me. Well done.
After many years together on the front line, the two have formed a close working relationship.
Alistair, I'm so sorry.
You missed.
It's not like your hair's going to go fluffy.
No.
Beautiful. She is beautiful.
Hi, police, it's how can I help?
Hi, I've got a Gunner multi-ability scooter, which has come off the curb. It's trapped underneath the scooter. It's causing heavy blood loss apparently.
Okay, we will be there as soon as we can, all right.
An ambulance is already on its way to the scene, but with reports of significant blood loss, Faye and Alistair's enhanced critical care skills are also needed.
So we're now going to have a 60-year-old gentleman who I believe has come off his scooter. And by scooter, I imagine it's like a motor scooter, trapped by his leg, and some blood loss from his leg. So not sure to what extent he's still under the scooter or trapped, and to what extent the leg injury is. 9-5.
The patient had double amputee. He's come off his scooter, mobility scooter. He's caused an injury to one of his films.
Roger, that's all received. Many thanks, Chris. We will give you an update when you get there. Thank you.
Roger, many thanks.
Arrived road activated.
Hey, right.
Are you okay?
That's Faye.
On arrival, the patient is lying in the road. The ambulance crew briefs Faye on their initial findings.
Police got here first. We'll put a tourniquet on the stump.
Yeah.
Right, okay.
So
it's a mobility scooter, so it's a wheelchair type scooter, so it's a wheelchair, electric wheelchair. Yeah.
he's come off. Apparently that's trapped him under it.
Yeah.
The right stump is bleeding.
Yeah.
What you can see on the floor.
So that's the extent of the blood loss just at the moment. Okay.
Malcolm, a double amputee, was on his way to a medical appointment. In the dark evening, he misjudged a curb, lost control of his electric wheelchair, and was thrown onto the road. A pool of blood is evidence Malcolm has sustained a nasty injury.
Hello, sir. How are you doing? My name's Faye, this is Alistair. I'm just thinking, what's the best way for us to get you onto that bed? You're used to this.
He's got no movement.
Why can't you push up? You got problems with your arms and your shoulders as well, or...?
Malcolm's lower legs were amputated as a result of severe diabetes complications.
You happy on this? Ready, set, flip.
To fully assess him, Faye and Alistair need to carefully get Malcolm into the ambulance.
Happy.
Have you bandaged those wounds, or...?
So I've bandaged the one on the left, but I've not managed to irrigate it yet. It's just a laceration on his left leg.
Right, okay. Is that the one?
Right.
And that's the one that's got the tourniquet on?
First to come to Malcolm's aid were police, who were in the area. They were so concerned with the amount of blood loss from one of his legs, they put on a tourniquet to stop the hemorrhage.
Malcolm, have you hurt yourself anywhere else? No? What did you do? Did you wobble off the side, or...? You can't remember? Okay.
In the fall, Malcolm may have also sustained internal injuries. Faye needs to do a thorough assessment.
Your tummy's quite an odd shape. Is that usual for you?
Yeah.
Right, okay. That's fine. You've got no pain in your tummy, though, from the fall. Okay.
Satisfied there is nothing immediately life-threatening, Faye and Alistair can now inspect Malcolm's injured legs.
Is this causing you any pain at all, young man, or not?
Is it painful? No.
So that's dressing around it, isn't it? That's not new today, is it?
That's a district nurse type dressing, isn't it?
Once the tourniquet pressure is released from Malcolm's leg, his bleeding could become excessive.
Right, we're going to take this tourniquet off you, Malcolm.
Oh, hang on, is this debris?
Some braking up ahead.
I'm going to get on the hard shoulder then, I think.
On the M5 near Birmingham, critical care paramedics Kerry Hemus and Ryan James are responding to an injured motorcyclist who has been thrown from his bike in fast-moving traffic.
There you go.
The location is, as you've identified, just before junction 4. We've got highways and police in attendance. We are on the hard shoulder. Lane 2 and 3 is still live. We'll give you a patient update shortly.
Yeah, all received.
Arriving on scene, an ambulance crew assesses the biker who is lying underneath a crash barrier at the side of the motorway.
All right, buddy. My name's Ryan. You're all right. How you doing? What's your name?
Tack.
Okay, Tack. How you feeling, mate?
Winded.
Okay. Do you know what happened, Tack?
I was just going along traffic. I saw cars. I wondered if they were all right. I had a look.
Yeah.
Or before I knew it, cars are stopping. I tried to stop.
Okay.
I'm only going 70.
Okay.
Back wheel comes up and I flip over. My bike flips over me even.
So have you actually hit the car or not? So you've broke heavily.
Yeah.
You've basically gone high-sided, gone straight over the front, landed on the floor.
In his attempt to avoid hitting a car, Tack braked so hard he upended his bike and was thrown onto the busy carriageway.
How have you got here?
I crawled over.
You've crawled over to been hit with?
Amazingly, he had made it to the hard shoulder without being hit.
Whereabouts is your pain?
It's mostly my left foot.
Yeah.
The middle of my foot.
Yeah.
My knuckles and my fingers on my right hand.
Okay. Anywhere else?
I'm just winded.
Okay. Just going to feel the back of your neck, buddy.
Yeah.
Okay. Any pain?
No.
Any pain? Any pain?
No.
Okay. What day is it today?
Friday.
Okay. Squeeze my hand.
Although Tack is conscious and alert, Ryan needs to check there are no serious injuries before he's happy to move him.
Squeeze my hand tightly? Okay, good. Can you feel me doing that?
Yeah.
What am I doing? Feel me doing that?
Yeah.
What am I doing?
Yeah, you're poking.
Any pain around your hip areas?
It's just a little bit sore. I think it's just something like that.
Okay, any pain here?
A little bit there.
Around your knee? Okay. Any here?
Same area on both legs.
Same on both legs, okay. Okay, can you put your legs straight for me? Together.
Tack is able to move his legs, a good sign that he hasn't fractured his pelvis. This injury can cause life-threatening internal bleeding if not immediately detected.
Just let me have your head. Just let me have...
So we just get one on his hips, one on his shoulder. He's just got a bit of pain around his legs, but he's actually not too bad.
Satisfied that he hasn't any obvious broken bones, Ryan can now move Tack onto the ambulance.
Okay, sit up slowly. Sit up slowly. Okay. How do you feel?
Sick.
Okay, just take some steady, deep breaths. Can you get your vomit bag, please?
Oh.
You're okay. Look at me. Look at me. Keep your head open. Chin up. Keep your eyes open. Slow, steady breaths.
The after effects of shock following his accident have made Tack hyperventilate. He's at risk of passing out if Ryan can't calm him down.
Okay.
They've just did their job, didn't they?
They've done a great job, mate. I think your leathers have, and that's what's really important. We see a lot of riders that don't wear the appropriate kit. You've done great. You've moved yourself out of the main live carriageways over to a safe area. All right, is that sickness gone a little bit?
Hey?
Is that sickness gone?
Really dizzy. I don't feel sick, I'm just really dizzy.
Okay, just slow your breathing down.
With his breathing back to normal, they can now get Tack to his feet and onto the stretcher.
Yeah. On three, ready? 1, 2, 3, push. Good. Okay, stand up straight. Let's take the jacket off. Okay, great. Right, have a sit there.
Okay, sit him. That's it.
Sit. Okay.
That's it, lovely.
Any new pain anywhere or anything like that?
No.
Okay, great.
No, I feel better.
Legs go up here, Tack.
On board the ambulance, Ryan can complete his examination.
So how do you feel, Tack, now, mate? Now we've got you off the road. I know you said you were feeling a bit stiff.
Yeah.
Okay. What we're going to do is we're going to slowly manoeuvre them off.
Is it hurting? Yeah, of course you can. Of course you can.
Yes.
Oh, God, that hurts. Oh.
There we go.
Okay, lovely. Just some abrasion, it looks like, on his distal thigh area there. I think you've been very lucky, Tack, if I'm honest with you.
I've been unlucky, I'm lucky.
Well, yeah, absolutely, you know,
I just want to know.
it's just what happens, isn't it?
You guys got a gauze?
Yeah.
Once his boot is off, the source of Tack's painful left foot is revealed. He will need his cuts treating and a thorough check over in hospital to rule out anything more serious. Kerry updates control.
So we've got a 21-year-old riding his motorbike. He's ejected off the bike. We don't believe he's been in contact with anything. He hasn't hit a car or anything. He's gone over the handlebars, landed on the road. We believe the bike may have sort of flipped onto him as well. He's actually been really lucky. We're coming off at Junction 4, so we're sort of Bromsgrove, Halesowen way. All right then, thanks, I'll speak to you in a bit, let you know when we're clear. Bye, bye-bye. This is paracetamol that we're going to give you through a vein.
All the best. All right, thanks, mate.
See you guys.
Now pain relief has been administered to keep him comfortable. Ryan and Kerry are happy to leave Tack in the care of the ambulance crew for the journey to hospital.
He's very lucky.
Absolute legend, yeah. I think the only thing that's potentially helped him out in this incident is traffic behind him was braking. So we can only assume that they've been able to see him come off his bike and been able to avoid him. And then he subsequently crawled himself over to the hard shoulder to safety. Scary, scary.
In Birmingham, Alistair and Faye are treating double amputee Malcolm, who lost control of his electric wheelchair and was found by police lying in the road in a pool of blood.
Can you lift that leg up again for me?
Oh, it is having a bleed, but just an ooze. We're happy with that. It's just an ooze. No need for tourniquet it.
Thankfully, even though the tourniquet has been removed from Malcolm's right leg, the bleeding has almost stopped.
139.83 with a pulse of 98.
Okay.
Normally suffers high blood pressure, just low.
Is it low for you?
Yeah.
Do you want medication for your blood pressure?
Yeah. Pop your finger in there, please, my friend.
Malcolm, to reassure you, it's not bleeding a lot, but you are going to have to go up to hospital to get it investigated.
Yeah.
Okay, so we'll pop a bandage back on it now. You assure us you're not in any pain? You sure? You would tell us, wouldn't you?
Malcolm lives in a care home and was on his way to a medical appointment when the accident happened.
See, the challenge is now is to get as good a dressing as yours. As yours was so good.
Is it police that did it, or you that did it?
So I did that one.
You did that one?
Yeah, police did it.
Sorry, Malcolm, you're doing really well to keep your leg up straight, so well done. Good stuff. Relax, sir. That's it.
With 2 new bandages in place, Malcolm's legs are now protected for the journey to hospital.
You assure us you've got no injuries elsewhere? You've got no injuries in your pelvis, in your bottom? Okay.
Now that Malcolm's bleeding's in hand, Faye and Alistair leave him in the care of the ambulance crew for the 2-mile journey to Birmingham City Hospital.
Awesome. Take care, guys. Have a safe journey.
Faye updates control.
9-5. So, gentleman has gone with the crew. They're going to go to City Hospital. As much as a tourniquet was applied, there was no catastrophic hemorrhage. The crew are happy to go to City and no alert necessary, and we are not needed. We're heading back now.